Hi, my name is James Jesso, and what you're about to hear is a clip from episode 196 of the Adventures Through the Mind podcast. This clip is with Dr. Alex Bekker. The larger episode is an exploration of chronic pain as a collection of conditions, and where psychedelic medicines, can fit into the treatment of chronic pain, specifically as novel treatment agents that are able to address the sort of multifactorial condition of chronic pain from multiple different directions or multiple different angles simultaneously. The clip you're about to hear, Dr. Bekker talks about how psychedelics can help with chronic pain in a similar way as to how it is that they help with addiction, even going so far as describing chronic pain as a kind of addiction. If at any point during this clip you'd like to just listen to the whole episode, you can jump over. There will be a little card up on the screen that takes you straight over there if you'd like to check it out. It's also available on all major podcasting platforms, episode 196. And before the clip starts, if you are interested in longer deep dive conversations on psychedelics, in particular questions that have to do with psychedelic culture, medicine, or research, please consider subscribing here to the channel. All right, enjoy the clip.
Actually, this probably good to bring point of addiction, which is one of the primary indication for these drugs, would be treatment of addiction in one form or another, opioid addiction or alcohol. They're trying for alcohol
nicotine,
addiction.
Yeah. Or nicotine, yeah.
Right. So which conceptually it's chronic pain. You can some way say it's addiction to feeling bad about something and feel bad about life. So you need to change this addiction. So addiction would be another great area when you kind of need to remodel whatever connection formed with dopaminergic receptor. You need to break it and start de novo. So I believe it would be, but it's so obvious. Depression is much bigger term, and many reasons. People, some of this grievance you're supposed to grieve. So it's to me, it's just such a big term, depression. Yes, I know scale psychiatrists do it by scaling. You have this, but there's so many aspects of it. PTSD and addiction, it's much clear.
You have like a particular sort of like thing you can point at. It's like, is this more or is this less? Where with depression, it's like so many possible areas.
True success with this drug initially, and if we have time, we can talk a little bit about company who developing this thing. But I think initial success would be absolutely shown for addiction and for PTSD. Chronic pain, they're indication, but they're not through a randomized controlled study, which any of these companies which developing right now, it's kind of side effect of they development chronic pain. I believe it will work because it's mechanism of depression, like they kind of all wrong unnecessarily. People are not born to be depressed. Sure, there's some genetic component you can argue, but generally we will develop this type of connection and this type of state. Very few people it's anxiety. It's a different for teenager, but through depression, it's a learned behavior. So treatment would be, we don't born with that. The same with chronic pain. It's a learned behavior, and we need to figure out how to unlearn it. Like PTSD was event, which creates something, and now you have to unlearn and take it out of your default mode. And this is what psychotherapists generally try to do, it to kind of move out of this vicious circle bad feeling, which create a bad connection with other people. I don't mean physical connection, emotional connection, and then it feeds back, and it's kind of feedback mechanism. You have to break it. Psychedelics, by changing this part, will, with help of psychotherapists, will help to reestablish your place in a outside in a world, and by this, it's kind of positive feedback. More you have connection with your, I don't know, friends, family, lovers, and things like this, more positive you would feel. It's kind of one thing leads to another.
Yeah, it's like the abundance of all the sort of like, quote, negative pain signals and the compensatory sort of responses in your brain and stuff will limit, and also like you'd said, the sort of the unconscious reinforced learning of like hurting and expressing my pain gets me care. Like all of that will actually limit positive, nourishing connections. And what you're speaking to is like getting more positive, nourishing connections is itself good, but then, and will like minimize the sort of like the pain stuff, but also the consequence of positive, nourishing connections is actually sort of like overall good for your system and can help even further reduce the sort of pain signals. And that psychedelics can, on multiple levels, put us in a pathway to make that more possible, thus make it possible to pattern it into ourselves, making it more available, and then sort of like an upward spiral.
It's all true, but with this thing, I don't want to ignore anti-inflammatory elements of the action, synaptogenesis element of the action, effect on descending. It's all there.
Yeah, it's all related.
It's all there.
Yeah.
But I think one of the main component why it would work, it because neuroplasticity and ability, our ability to relearn thing, and when the clear depression, so many connection, chronic pain also many, but something like PTSD and dependence, it's much more clear cut. So I think it would be first success we will see. Don't know, we already have successes. I mean, commercial companies developing, but this is one of the goal. Anxiety, difficult to define, but here it's kind of very defined event. Actually, with chronic pain, just 1 second. With chronic pain, by alleviating comorbid condition like depression, anxiety, and PTSD, they indirectly affect perception of chronic pain. It will indirectly affect it.